Hello, I am Jihane AKAMI. I am a PhD student in the Laboratory of Economics and Management of Organization at the Faculty of Economics and Management, Ibn Tufayl University in Morocco. Today, I will present a topic on human capital in Morocco in the COVID-19 pandemic era. This is my very first paper in my doctoral career, and I'm very honored to participate to this conference. By way of introduction, let's say that at the end of the Second World War, especially during the period known as the Glorious 30, it's the period between 1945 and 1975, the importance of an economy was measured through material capital and tangible resources. Nowadays, a new component has been added to these resources, which is intangible capital, or the economy's capacity to accumulate talent and knowledge. The goal is to provide the economy with other competitive advantages such as innovation, the creation of new concepts, and the production of original ideas. In the same way, the importance given to the intangible capital in recent years has led to the emergence of an economy known as the knowledge economy, according to which the wealth of a nation lies in its human capital. This capital is therefore becoming particularly important as it is an essential component of intangible capital. This study attempts to answer the following question. What is the situation of human capital in Morocco, and what are the effects of the COVID-19 pandemic on these essential components of intangible capital? To answer this question, we have taken a positivist methodological approach in order to confront the theory with the situation of the human capital in Morocco, notably in the particular context of the COVID-19 crisis. Coming to the summary, the plan is to present our work in two parts. The first part is dedicated to the definition of the key concepts of our research, namely intangible capital and human capital. The second part includes a first axis in which we will discuss the situation of the components of human capital in Morocco, namely education, the health sector, and the early childhood. In the second axis, we will try to analyze the situation of human capital in the particular context of the pandemic of COVID-19 by discussing the effects of this crisis on each component. Let's move on to the first part of this presentation to define the key concepts of our research. The first definition is the definition of intangible capital, which corresponds to the country's wealth that cannot be explained once produced capital, natural capital, and financial capital are taken into consideration. The intangible capital includes three components. The first component is human capital, which represents the people and their abilities, the research and development efforts, and innovation. The second component is social capital, which refers to the set of standards governing the functioning of the society. The last component is the institutional capital, which is related to the functioning of institutions and their quality. The second definition we present is the definition of human capital. According to the World Bank, the reinforcement of the human capital is essential in the pursuit of new skills and the improvement of employment opportunities. In other words, the human capital is the set of human abilities with the aim of preparing individuals for jobs with higher qualifications. In order to measure the participation of health and education in the performance levels of the future generation of workers, the World Bank has proposed an indicator called Human Capital Index, or the HCI. We get the HCI by multiplying the schooling years and training quality by the health conditions and life expectancy and the percentage of survival to age 5. The calculation of these parameters give a total between 0 and 1. The closer the indicator is to 1, the better the performance of a country's future generation will be. Coming to the second part of this presentation, in which we'll discuss the situation of the components of human capital in Morocco in the light of the COVID-19 crisis. According to the latest World Bank report on human capital, the HCI in Morocco in 2020 is around 0.5. Education is the HCI variable that penalizes the kingdom the most. Let's move on to the first axis in this presentation, in which we will conduct a situational analysis of human capital components in Morocco. The first component of human capital that we will present is education. During the year 2015, a report by the Higher Council of Education, Training and Scientific Research listed a set of anomalies that interfere the proper functioning of the Moroccan school. These dysfunctions are linked in particular to the poor language skills, the difficult integration into the job markets for the graduates, deficiencies in the initial training, and the poor use of educational technologies. The second component of human capital is the health sector. The health sector in Morocco accounts for only 1% of employment. In Morocco, healthcare provision is penalized by the low number of people working in the health sector, the inequalities between regions, the phenomenon of repeated absences, and dual functions. The last component of human capital is the early childhood. The current state of early childhood care in Morocco highlights difficulties related to the infant mortality rate, which remains high, the decrease of preschool enrollment, and the very limited involvement of fathers in the education of their children. Coming to the second axis, in which we will discuss the situation of the components of human capital in Morocco in the light of the COVID-19 crisis. During the containment period, online school has been adopted in order to protect the health of students while ensuring the continuity of educational training. In Morocco, the decision to opt for distance learning has exacerbated educational inequalities. The crisis has also led many parents to choose to return to public schools because of economic difficulties. In addition to the negative effects of the health crisis on the education sector, the crisis has revealed initiatives that stimulated innovation in the educational sector, especially through the use of the ICTE. The second sector that has been affected by the crisis is the health sector. In Morocco, the management of the health crisis has been exemplary as far as the kingdom has put in place considerable measures. Let's remember that Morocco has not escaped the different waves of contamination of the COVID-19 and has recorded thousands of cases of contagion in different regions. However, we note that most cases of infection are recorded in the major regions of the kingdom. This regional disparity is explained by the presence in these regions of quality health infrastructures, the level of awareness of the population, and the effectiveness of COVID-19 tests. The last component of human capital that has been affected by the crisis is the early childhood. The coronavirus continues to have negative effects on the schooling of this generation, especially for children whose parents have chosen not to send them to nursery or school. In most cases, these children do not benefit from any support from their parents due to their poor command of the tools of cognitive and psychomotor development. Ultimately, we have concluded that this crisis has had negative effects on each component of the human capital, and that Morocco is called upon to multiply its efforts to promote the human capital, particularly in the post-COVID context, which calls for commitment and resilient projects with aspiring goals such as overhauling the education and health systems, increasing efforts to protect early childhood. Thank you for your attention.